Hello students, I am Dr. Divya Gupta, original guru of Periodontics at DBMCI, and today we will be discussing the questions of NEET GT 12. So let us start the discussion. The first question is, which is the first line of defense in gingival sulcus? The first line of defense in gingival sulcus options are option number A, neutrophils, option B is plasma cells, C is macrophages, and D is T lymphocytes. This is one of the questions which is most frequently repeated. Like this is one of the topic which is most frequently repeated, and we get questions from this topic. The answer to this question is option number A, which is neutrophils. Okay, the answer to this question is option number A, which is neutrophils. Now the next question. A 55-year-old patient with periodontal pockets. A 55-year-old patient with periodontal pocket complains of pain and purulent discharge. What is the most likely diagnosis? Options is option number A, gingivitis, B is periodontal abscess, C is periapical abscess, and D is endoperial lesion. Now there is periodontal pocket present, there is pain and purulent discharge. The answer to this question is option number A, option number B, which is periodontal abscess. Okay. Now the next question. Which healing pattern is seen in the below image? Which healing pattern is seen in the below image? Now, in this image, you can see that this is what? This is the gingival epithelium, and the gingival epithelium migrates from above into the connective tissue, right? It is the rapidly progressive cell. Epithelial cells are the most rapidly progressing cells. They are migrating downwards. They are migrating downwards and forming long junctional epithelium. They are forming long junctional epithelium, and healing by long junctional epithelium is called what? Let us see the options. Options are option number A, repair, option B is regeneration, option C is reattachment, and option number D is new attachment. So healing by the formation of long junctional epithelium is option number A, which is healing by repair. In new attachment, you will see whenever we are using a GTR membrane, the epithelial cells are prevented from moving downwards, and the periodontal ligament cells. The fibroblasts will get sufficient time to form periodontal ligament, and osteoblasts will get sufficient time to form the bone. So they will form the new attachment, right? So regeneration and new attachment are nearly same, guys. But in Carranza, there are two different definitions given for both. So just mug up the definition, and if the same definition is asked in the exam, that will be the answer. Now the next question. The orange complex bacteria includes option A. Orange complex bacteria includes option A. Prevotella intermedia, Streptococcus, Fusobacterium nucleatum. Option B is P. gingivalis, Trichonema denticola, and Tenerella fasciatia. This is red complex, right? This is red complex. Option D is Capnocytophaga, Campylobacter, and Streptococcus. No. And option number D is Streptococcus mutans, Lactobacillus, and Actinomyces. Now here, the answer to this question is option number A, which is Prevotella intermedia, Streptococcus micros, and Fusobacterium nucleatum. Fusobacterium nucleatum is one of the most important bacteria of orange complex, and it is a bridging bacteria. It is a bridging bacteria. The answer to this question is option number A. Now the next question. Which type of graft is most predictable for root coverage? Which type of graft is most predictable for root coverage? Options are option number A, free gingival graft, option B, subepithelial connective tissue graft, option C is pedicle graft, and option number D is allograft. The answer to this question is SCTG, subepithelial connective tissue graft. Now the next question. Which of the following is not a function of PDL? Which of the following is not a function of PDL? Options are shock absorption. Option B is sensory input. Option number C is storage of fat. Option number D is supporting the tooth. The answer to this question is shock absorption is a function, right? Sensory input is a function. It has sensory fibers. D, supporting the tooth, is a function, right? So the answer to this question is option number C, which is storage of fat. Now the next question. Image shows fiery red glazed gingiva. Patient reports burning sensation. Middle-aged female, most likely diagnosis. Fiery red glazed gingiva. Patient reports burning sensation. Middle-aged female, most likely diagnosis. Disformative gingivitis. Option B is NUC, option C is leukoplakia, and option number D is pyogenic granuloma. This is absolutely not a pyogenic granuloma. This is option number A, which is T-spermative gingivitis. This is option number A, which is T-spermative gingivitis. The patient has some underlying skin condition. Which bone defect has the best prognosis for regeneration? Option A is one-wall defect, B is two-wall defect, C is three-wall defect, and D is horizontal defect. Now here remember that two-wall defect can be crater, but crater is not a type of vertical defect. So I'll not keep two-wall defect as crater. So with the defect with the best prognosis for regeneration is option number C, which is three-wall defect. Now the next question. A patient presents with mobility. Pus discharge and percussion involvement. Which is the best initial management? The patient has mobility, pus discharge and percussion involvement. The best initial management is extraction. Option B is scaling, root planing. Option number C is flap surgery. Option number D is occlusal adjustment only. Just option number here, the answer should be option number B, which is scaling and root planing. Occlusal adjustment will not, the first initial management, the best initial management. Look at the keywords, guys. Keywords is very important. So the answer here will be B. And some of you might get confused with D, but D cannot be the answer here because these signs, when present, we first have to do scaling, root planing and see whether there is mobility present or not. After that, if still there is there, you have to look for signs for trauma from occlusion also. Okay. Now the next question, which probe is color coded at 3.5 and 5.5 millimeter black band? Options are option number A, Williams probe, B is UNC 15 probe, C is CPITN probe, and D is Neighbors probe. The answer to this question is CPITN probe. CPITN E probe is coded at 3.5, 5.5. Okay, so the answer to this question is option number C, which is CPITN probe. Now the next question, which is the most common bone defect in periodontitis? Options are option number A, one-wall defect, two-wall defect. Option number C is three-wall defect. Option number D is four-wall defect. The most common bone defect in periodontitis, is a two-wall defect, which is a crater. Crater are the most common type of defects which you will see in periodontitis. So the answer to this question is option number B. Now the next question. Radiograph shows vertical bone defect on mesial of forceps. Best treatment. It is a vertical bone defect. The best treatment is extraction, regenerative therapy, gingivectomy, and antibiotics only. Here, this bone defect looks as if there can be regenerative therapy possible. So we have to raise the flap and look, place the GTR membrane, place a bone graft. So it is option number B, regenerative therapy. Now the next question, which of the following are the features of localized aggressive periodontitis? Here, this is a multiple answers are correct. Option number one is affects less than 30% of the sites. Yes, this is true. First molars and incisors are involved. Yes, this is also true. Strong familial aggregation. Yes, and actinomyces species is predominant. Yes, all four options are correct. The answer to this question is option number D, which is 1, 2, 3, and 4. Now the next question. Histology shows bacterial plaque with calculus covering the root surface. So here they have given that it is a calculus. Which type of calculus is this? It is a subgingival calculus or a supragingival calculus or a ceruminal calculus or D? None of the above. Now, this here, it is a subgingival calculus. Now, guys, remember that previously, it was called subgingival calculus was also called as a ceruminal calculus. But as this is an old terminology, this is very old terminology and now it is not used. So the best answer to choose here is subgingival calculus. If option D was A and C, then the answer will be D. Okay. So with this, we have completed the discussion of NEET GT12. If you have any doubts, do ask in the Telegram group. Thank you so much and take care. All the best.